And uh, Nagesh would come next.
Good morning. At the outset, I thank IOC and Madan for providing me to be a part of this instruction course. My topic will be on the lasers and the delivery system. I'll try to keep my slides very straightforward and very practical approach, right? So I don't have any financial interest. So if you look at the plethora of machines, the laser delivery systems that is available in the market, probably many people might be very well versed with JICE, and then Redex, and then of course APA, ROLab, Quantiles, we have Navilas, and then Enlightenment. There are a lot of machines are available with a lot range of different wavelengths and different delivery systems and different modes are available. So I'll try to touch upon the each and individual laser machines available and what are the additional advantage over one over the others. So if you look at the first thing that we need to look at whenever we want to buy a laser machine should be either you want to buy a simple green one, the conventional one which is very familiar with, or if you want to go with an yellow laser, or we have a red or the diode. As you know, at this point of time, the yellow laser is coming up in a big way because of the reason that it has very least toxic effect on the macula. Suppose someone want to have more work, or you want to do a laser more in exudative maculopathy disorders, probably yellow laser should be a best option for us, and provide along with that we have a micropulse technology also. So yellow laser with a micropulse technology would be a best option if you have the patient load who have more often have the macular disorders. Otherwise, routinely or conventionally we keep doing with the green lasers, and of course diode laser also we can have it, especially in the OT setups. And if you look at the delivery systems, conventionally and majority of the companies do have the slit lamp delivery system, and additionally we can have either LIVO or we can have endoprobes, and few companies have come up with attachments where you have a slit lamp at your OPD, you can attach with the laser system to the existing OPD slit lamp. So just we need to check the models which is compatible with the slit lamp laser adapters. It's hardly a 5-minute job where the company people will come and attach the laser unit to your existing slit lamp, so that you can use the slit lamp as both as a diagnostic as well as therapeutic. So it decreases your cost of having a separate slit lamp unit as well. And then there are a few machines which come with a simple single spot, and then nowadays all the machines are getting upgraded, and you have option of upgrading from the single spot lasers to a multi-spot lasers, and even there are a few pattern spot lasers, and all these things are continuous lasers. And then nowadays we have a micropulse technology where the energy delivery will be very precise, and it will be very fraction of seconds, so that will cause a less tissue damage. So that is a technology where micropulse is playing a play. Now the machines have come up with both green laser micropulse as well as yellow laser micropulse. The option is left to us whether to choose for the micropulse, yellow laser, or the green laser as well. And of course, even the micropulse comes with a single spot, and it comes with a multi-spot or in a customized pattern as well. So to be what are the things that we need to keep in mind when you want to buy a laser machine? So first of all, it is a turnover of the patients, and then the turnover of the patients who need a lasers, whether it is a focal laser or it is a pan-retinal photocoagulation, and whether you want to use the laser machines for the OPD and OT altogether, or it's only the OPD practice that you are most of the times you are busy with, or it is a multi-stational utility, whether you want to carry the laser machine to different setups where you might be having a practices in different places, 2-3 places. If you want to carry it as like a portable slit laser machines, that is one thing you need to keep in mind before deciding which laser to be buy. And of course, accessories, services, AMC, CMC maintenance are quite different for different brands. Of course, the Indian brands, the services, accessories, always it will be cheaper than the foreign brands. That is one thing we need to keep in mind. And then the ports. So usually the console of the laser will have a ports where you will have a single port or double port, where you will be attaching the slit lamp laser cable to the single port, or if you have a double port, you can attach the slit lamp cable to the one port and then LAO to the other port. So that will avoid you to keep changing your ports again and again. So that increases the longevity of the cables, because the cables again, once it get damaged, you will be spending again 1 to 2 lakhs rupees on the cable itself. So before buying the machine, probably you need to look at whether the console has double ports or the single ports. That's the one thing important. Of course, at the end, everything boils down to the cost. So we always keep looking at the lowest cost of the machines which are available. So I'll just briefly touch upon the different companies which have uniqueness compared to the other one. The Visualas, either you will get, this is the classic model and the comfort model, where you can upgrade the comfort model from the single spot to multi-spot. They have again single port and double port. And then VisualLink is something like an adapter where you can use that adapter for the existing slit lamp. And of course, the console is very, very smaller and it is portable. Now it is called as Visualas Green because it was Visualas S. Redex is the one company which is exclusively towards the laser. They have all kind of lasers starting from single port, multi, micro pulse, both in the green and yellow. And of course, console is very, very portable. And of course, is somewhere around starting from 30 lakhs to 50 lakhs. And in a cheaper the economical models, we have Apaswamy, where they have a single sun multi-spot, they have a slit lamp and an LAO. And then console, of course, it is fixed to the chair unit. You can't it can't be portable to the OT and all those things. And the cost will be half of the cost of the previously mentioned slit lamps. We have exclusively yellow lasers, the Quantiles, where they have single, multi, and sub-threshold spots. Again, the console is fixed to the slit lamp. It can't be portable. This is exclusively yellow lasers, where if you are really fascinated about treating the macular disorders and all, probably this should be the one of the choice. Of course, again, the cost will go up with this one. And we have Auro Lab, Auro Lace. Again, this will be a more economical one. They have this again. It is a portable. We can carry this to the both OPD and the OT. And they have a slit lamp adapters as well. So it can be fixed to the all newer models of diagnostic slit lamp that is there in your OPDs. Again, Enlightenment, again, it has both green, laser, infrared, diode, all kinds of available depending upon the money what we are spending on it. And apart from that, we have accessories that we need to keep in mind. Majority of the companies, they give this either focal and pan-retinal lasers. And most of these things have inbuilt transformers, so you don't need to be worried about the power flow. And all these laser machines do work with a single phase, 10 amperes current. That is more than enough, right? So at our set, we have so many options like yellow, green, red diode, single port, pattern, micropulse, and how it matters. So what are things, what it decides to go about. If you look at the literature about all these laser systems, so much about the literature talked about the laser running time, patient comfort, laser precision. Of course, they are really matters, but they are very, very minor when you want to buy a laser machine for your private setup. And of course, predominantly, if you are working on the macular disorders or the extramacular disorders, again, that will decide whether you want to go exclusively for the yellow lasers, the green lasers. And at the end, the cost, it matters. So probably that is the reason why you want to go with a single one, or the combo, or the fixed or portable one. And so looking at the finance part, of course, the laser workstation stands lost in the finance part. We will be catering only 5 to 8% of your budget for the lasers. That is what you need to keep in mind before setting up a laser workstation. If you look at the hierarchy of the value added laser workstation, probably you need to check it locally whether you have a circulating laser systems where a person will be traveling that laser machine in his van to different hospitals. Probably that is what you need to work out. If at all you are not ready to buy a workstation, and it will work out very, very cheaply. And probably if you can have a single slit lamp adapters, if your slit lamp is compatible with the company's models. And the next hierarchy will be a simple green single spot laser that comes from 12 to 15 lakhs. And then even you can have LAO as attachment, or you may not be having LAO. That also comes down your cost by 2 to 2.5 lakhs. Then a multi-spot, again, it adds up around 10 lakhs extra for your single spot. Then the pattern laser and micropulse delivery, again, it adds up around 5 to 6 lakhs extra for you. And the budget is not a constraint. Probably you can go for the combi lasers where you have retinal lasers along with the YAG laser. All in one, it will come together. But again, the cost will go up to around 50 to 60 lakhs rupees. So that's how. So probably this is how we need to work on for the lasers, because it may not be a main part of our armamentarium in private practice, but still for the least cost, probably we'll be getting your work done. Okay, thank you. Yeah.
Thank you, Nagesh. Thank you. Extensively covered.